Welcome back to this familiar space for senior healthcare. This is where I share simple yet practical tips to help you live healthier, stronger, and more connected every day. Health after the age of 60 is not just about test results. It is also about the feeling of being yourself, from peaceful breathing to warm moments with loved ones. Today, we will take a closer look at a very familiar ingredient in your kitchen: baking soda. More than just something used for baking or deodorizing, when used correctly, baking soda can become a supportive companion that helps improve blood circulation, support hormonal function, reduce nighttime urination, and most importantly, preserve the emotional connection that often fades with time. According to data from the National Institute on Aging (NIH), over 58% of men over the age of 60 begin to experience a circulation decline without realizing that the root cause lies inside the blood vessels. Dr. Michael Irwig, a hormone specialist in the United States, also notes that one of the most overlooked factors is pH imbalance and its effect on the cardiovascular system and male function. Stay with me until the end of the video so I can show you how to use baking soda safely, effectively, and in a way that suits the aging body. And if you're on a journey to care for yourself, feel free to leave a comment with your country and age so I can better support you along the way. 1. Why does blood circulation decline after age 60? As we pass the age of 60, many people begin to feel that their bodies are slowing down. A few steps up the stairs may leave you more breathless. In the morning, your hands and feet may feel cold or numb. And perhaps most puzzling is the loss of a certain inner vitality, the excitement, connection, and energy that once came naturally. These changes are not caused by negative thinking or emotional stress. They often begin with a slow but persistent decline in blood circulation. According to experts from the American Urological Association (AUA), after age 60, the body's level of nitric oxide, a key molecule that helps blood vessels relax, begins to drop significantly. Nitric oxide is like the key that unlocks the blood flow valve, allowing blood to reach all organs, from the brain to the sensitive areas involved in male function. When nitric oxide decreases, blood vessels become stiffer, and the ability to deliver blood to vital areas is reduced. As a result, you may feel tired, less motivated, unable to sleep deeply, and disconnected from your natural sense of intimacy. In addition to nitric oxide loss, aging also reduces the elasticity of blood vessels. The smallest vessels, especially in the hands, feet, and prostate area, can become hardened, restricting blood flow. This explains why many people over 60 experience cold hands and feet, frequent nighttime urination, and difficulty maintaining hormonal balance. Another important factor is lifestyle. After many years of eating fewer vegetables, moving less, and consuming more sugar and processed food, the body can build up free radicals and hidden inflammation. These substances gradually wear down the blood vessels and block the natural flow of blood. Over time, a lack of proper blood supply develops in key areas, leading to signs of declining vitality. Miss Charles, a 71-year-old retired physical education teacher from Michigan, once shared that he did not feel weak, but had lost the spark to begin each day. After medical testing, he was found to have mild circulation issues and a pH imbalance in his blood. Interestingly, after using natural dietary support and making a few simple changes, including taking baking soda the right way, he reported that within just 3 weeks, he felt almost normal again. He slept better, had less fatigue, and most importantly, reconnected with his own body. That is why understanding the root cause of circulation decline is the first step in regaining a fuller rhythm of life after 60. 2. How does baking soda affect circulation and hormonal health in older age? When people think of baking soda, they often only associate it with baking or relieving heartburn. But few know that this simple white powder can become a powerful ally in improving blood circulation, supporting hormone function, and restoring male vitality in older adults if used correctly. After the age of 60, the body often enters a state of mild acidosis, meaning that the pH of the blood and tissues becomes more acidic than ideal. This condition can result from a sedentary lifestyle, high protein intake, low vegetable consumption, and chronic stress. When the internal environment becomes more acidic, blood vessels tend to constrict, blood flow slows down, and the production of nitric oxide, a molecule essential for vessel relaxation, is negatively affected. According to research published by the National Institutes of Health (NIH), baking soda, with its natural alkalizing properties, may help rebalance the internal environment by neutralizing excess acid. When the body becomes slightly more alkaline, blood vessels have a chance to relax, circulation improves, and more oxygen reaches the brain, heart, and the urinary and male vitality systems. One important benefit of baking soda is its indirect effect on aging-related hormones. When circulation improves, both the pituitary gland and adrenal glands, which are responsible for producing key hormones for male health, can function more efficiently. This helps support mental clarity, better sleep, reduced fatigue, and an improved mood. These are foundational for adults over 60 to maintain an active lifestyle and emotional connection. However, baking soda is not a magic cure and must be used properly. Dr. Michael Irwig, a hormone specialist in Washington, D.C., recommends that older adults take only about 1/4 of a teaspoon of baking soda mixed with 1 glass of warm water, about 200 milliliters, to be consumed in the morning on an empty stomach, 3 to 4 times per week. Overuse may lead to excess sodium in the body, placing stress on the kidneys and raising the risk of high blood pressure. Some individuals need to be especially cautious. Those taking diuretics, heart failure medications, or those with kidney conditions should consult a doctor before using baking soda regularly. Baking soda is only one small link in the chain of restoring vitality in older age. For lasting results, it should be combined with natural vegetables, light exercise, and the daily practice of a positive, balanced lifestyle. 3. How to use baking soda correctly, and 5 mistakes to avoid. A small change, when done correctly, can lead to a big improvement in senior male health. This is especially true for baking soda. But to achieve the desired results and avoid potential risks, it must be used carefully and based on proper scientific guidelines. First is the dosage. Each time, only about 1/4 of a teaspoon, around 1 to 1.2 grams of baking soda, should be dissolved in a glass of warm water. Approximately 200 milliliters. The best time to drink it is in the morning, on an empty stomach and before your first meal. This is when the body naturally has higher acidity, so the pH balancing effect will be most effective. Never drink baking soda immediately after a meal, as it can interfere with digestion. As for frequency, older adults should only use it 3 to 4 times per week. Taking it daily for a long time can disrupt electrolyte balance, increase blood sodium levels, and affect blood pressure, especially in those with a history of heart disease or who are taking diuretics. To enhance its effects, you may add a few drops of fresh lemon juice to the baking soda drink, the natural acid from the lemon, when combined with the alkalinity of baking soda, gently stimulates digestion, supports liver function, and helps improve nutrient absorption. However, to avoid side effects, here are 5 common mistakes you should remember. First, taking high doses. Many people think that taking more will work faster. In reality, higher doses can cause digestive discomfort, bloating, and even dangerous electrolyte imbalances. Second, using it every day without breaks. The body needs rest days in between to allow the kidneys and circulatory system to stabilize. Third, using low-quality or non-food grade products. Be sure to choose one labeled pure baking soda or food-grade sodium bicarbonate on the package. Fourth, mixing with water that is too cold or too hot. Warm water is best, as it allows the powder to dissolve fully and helps the body absorb it more easily. Fifth, not consulting a doctor if you have existing health conditions. People being treated for high blood pressure, kidney disease, or those taking acid-base regulation medications should seek medical advice before starting. Baking soda is not a replacement for medical treatment. It is a supportive tool to help improve circulation, boost vitality, and support hormone balance in older age when used in the right dose and in the right way. 4. A real-life story from fatigue to restored vitality. Positive changes after age 60 are not uncommon. When we listen to our bodies and make the right adjustments, the results can be surprisingly powerful. One clear example is the story of Charles, a 71-year-old man living in Oregon, United States. Charles used to be a high school basketball coach and lived a very active lifestyle. But after retiring, he began to notice significant changes. Every morning, he would wake up feeling tired and sluggish. Even a short walk left him short of breath. He also started to struggle with maintaining connection with his wife, not just physically, but emotionally as well. After several checkups, his doctor confirmed that Charles had no serious illness. However, his blood circulation was slowing down, and his hormone function had begun to decline, a common issue in men over 60. Instead of prescribing more medication, his family doctor, who supports natural care methods, suggested a simple remedy using baking soda along with a low-salt, vegetable-rich diet. At first, Charles was skeptical. How could the baking ingredient possibly improve his condition? But he decided to give it a try. Following the instructions carefully every morning, he drank 1/4 of a teaspoon of baking soda dissolved in warm water, with a thin slice of lemon. Just 3 times a week. After 2 weeks, Charles called his doctor. He described the changes: deeper sleep, lighter mornings, and no more dizziness when standing up quickly. What surprised him most was the return of the emotional connection with his wife, not through anything dramatic, but through quiet moments, making tea together in the evening, talking, and truly feeling each other's presence. After a month, he shared, "I'm no longer a coach on the court, but I've become the leader again in my own life." Charles is not alone. According to a survey from the American Urological Association, more than 68% of men over 60 said they had experienced a loss of energy without knowing the exact cause. Meanwhile, research from the National Institute on Aging shows that improving circulation and balancing hormone can help reverse many aging-related issues tied to urinary and male health. Charles's story is inspiring not just because of the results, but because of his brave choice to change. It reminds us that we do not need complicated solutions to begin the path to recovery. Sometimes, 1 glass of warm water each morning is enough to switch on a part of the body that has been quiet for too long. Full body impact. from blood circulation to emotions and connection. After turning 60, many people believe that fatigue, poor sleep, or a fading emotional connection are simply part of aging. But the truth is, it's not age itself, but rather the silent decline in blood circulation and hormonal imbalance that often lie behind these changes. When you start supporting your body from within, the positive effects can show not only in physical health, but also in emotional well-being and mental clarity. Improving blood flow is the first step. When circulation is strong, organs throughout the body, including the brain, prostate, kidneys, and endocrine glands, receive enough oxygen and nutrients. This helps restore hormonal balance to a more stable state. As a result, symptoms such as fatigue, nighttime urination, or low energy begin to ease. Sleep improves, memory sharpens, and you feel more alert during the day. What surprises many people is the emotional impact and the effect on relationships. When circulation improves, your sense of presence within your own body becomes clearer. The feeling of being disconnected from yourself begins to fade. Many people begin to reconnect with their spouse, with grandchildren, and with small joys in life that they may have overlooked before. Several patients who followed proper baking soda routines shared that they became more patient in conversations, felt calmer, and especially noticed the return of a warm feeling when holding or touching a loved one, something that might have faded without them realizing. This is not a coincidence. Studies from Harvard and the National Institute on Aging show that improved blood circulation can help lower cortisol levels, the stress hormone, and increase serotonin, the brain chemical linked to happiness. In short, when your blood flows better, your mood lifts too. For men especially, once the prostate is well nourished, urinary function becomes more stable. Nighttime trips to the bathroom decrease significantly, and sleeping through the night becomes possible again. That alone can dramatically boost your daytime energy. But it's not just about the physical. The feeling of being back in control of your own body, living in a more energized version of yourself, helps reignite confidence, something often clouded by the quiet fear of getting old. And when you feel stronger and more positive, the people around you can sense it too, responding with warmth, shared moments, and renewed emotional connection. We sometimes assume that restoring male health or improving married life requires expensive or complicated medical treatments. Yet in many cases, caring for blood circulation with a simple habit like drinking a glass of baking soda water in the morning, can be a solid starting point. From there, emotions, energy, and connection can return in a natural, warm, and lasting way. We have just explored the simple yet powerful secret using baking soda the right way to support blood circulation, improve hormone function in later life, and enhance overall well-being after age 60. From understanding why blood flow slows down, to how baking soda actually works by balancing internal acidity and opening blood vessels, we can see that the body can be supported gently and safely, without the need for aggressive interventions. You don't have to change everything overnight. Sometimes, just one small step, like a glass of baking soda water in the morning, can be the beginning of renewed vitality. Better sleep, fewer nighttime trips to the bathroom, and most importantly, a deeper emotional connection with your loved ones. If you have ever felt that these things were out of reach, I hope this video has shown you that there is still so much you can do. Of course, everybody is unique, so please remember to consult with your doctor, especially if you have chronic conditions or are taking prescription medications. Being cautious is an essential part of healthy aging. If you found today's content helpful, Don't forget to subscribe so you won't miss the upcoming videos. In the next one, I will guide you through 5 gentle exercises to improve pelvic strength and reduce urinary leaks in later life. Thank you for watching. Taking care of yourself is one of the most loving gifts you can give to those who care about you.